For many, the mention of arthritis would easily be equated to old age. However, did you know that this disease can affect children even as young as 10 months old? Today in Health Unlimited, we focus on juvenile arthritis. Children are naturally born to be active. However, when a child suddenly becomes withdrawn and worse appear to be in pain, worry sets in. And that is what Rose, not her real name, had to contend with when her daughter turned 1 year and 2 months old.
When she started limping, we could go to hospital probably when she has a cold. Now after the doctor has seen her, you ask her, and by the way the baby is limping, is there any cause of alarm? And the doctor would tell me, no, she's just learning how to walk. The doctor, on examining the baby is having this so much pain, the fevers are so high.
Unaware of what was causing the persistent fever and the unexplainable pain her daughter was in, Rose embarked on a journey of countless trips to the hospital, where she says each visit came with a different diagnosis. By now, when all medications tried on the young baby Talia, also not her real name, failed to work, doctors recommended surgery, but her condition did not improve nonetheless.
We stayed for around another 1 or so or 2 weeks. The pain was back.
Dr. Angela Migoa, a pediatric rheumatologist who explains the diagnosis that saved baby Talia the agony of countless hospital visits, says about 6 million children in the country have juvenile arthritis, whose cause is often not known.
It's estimated that for every 1,000 children, there are about 3 with juvenile idiopathic arthritis. The one that is reported to be quite common is what we call the oligoarticular juvenile idiopathic arthritis. Oligo means few, so this is arthritis that affects 4 or less joints. This commonly happens in children at around the age of 1 to 3 years. It appears that girls are also commonly afflicted by it. Most of the time, the exact cause is unknown. That's why we have the term idiopathic in the phrase juvenile idiopathic arthritis. But we know there are certain triggers, okay, that can evoke the disease process. One of the triggers that is well known is infection, okay. Another trigger that is also very well known, sometimes even vaccinations, could trigger.
She says in a week she can attend to between 6 to 15 patients with different rheumatological diseases, where about 30% of these are due to arthritis.
If you see your child was very active, especially in sports or games that require a lot of movement, a lot of use of your arms and legs, and all of a sudden the baby for some reason is now pulling back, that should raise an alarm. The other thing is if you notice any obvious swelling of the joints.
She adds the treatment for the disease requires a holistic approach and that the child will have to be on lifelong medication to manage the disease. Gloria Ilimu, K24 for Health Unlimited.